Hi, my name is Mfanikono. Welcome back to my YouTube channel, and today let's talk about what fibroids are, the symptoms, and whether they affect fertility. Fibroids are non-cancerous growth that grows in or on the uterus. Uterus is the womb, and the fibroids, they are actually made up of lumps. They are lumps made up of muscle tissues. They are not cancer, they are common. In fact, many women have fibroids and are not even aware of it. So yeah, let's dive into. Fibroids can grow inside the wall of the uterus, inside the cavity of the uterus, and also the outer surface of the uterus. The inside wall is called intramural, and the outer surface of the uterus is called subsisteral. We don't know the actual cause of fibroids, but it is actually linked to an hormone called estrogen. And fibroids absolutely has a lot to do with the reproductive health. And you should know it grows during the reproductive years and shrinks after menopause. The risk factors include family history, that is, you might get it if your mom had it, African descent, um, being in your 20s to 30s, yeah, that is the highest chance for it. And another is early onset of menstruation, yes. Some women have no symptoms of fibroids, but if at all you have symptoms, or no, some women have no symptoms of fibroids, but if at all, the symptom you should look out for is heavy menstrual bleeding, passing out blood clots, having menstruation for more than 7 days, fertility issues, not being able to get pregnant, pelvic pains, swelling of the abdominal stomach. We should know too that not all fibroids causes infertility. And fibroid that causes infertility is mostly due to the size, and it's also due to the location too. But you should also know that the fibroid inside the uterine cavity are more likely to affect pregnancy. But although some people can still, not even some, you can still get pregnant despite this. Yeah, that's just the confused part of this whole thing. Fibroid is diagnosed through pelvic examination and ultrasound scan. Now, treatment of fibroid depend on the symptoms, the size. If you want children, you don't want children, that's how you'll be treated based on what you're going through or what you want. Either ways, treatment options include medication, which is to shrink the uterus temporarily, a bit treat which is to shrink the fibroid temporarily and stop bleeding. We also have the surgery, which is the myectomy. The myectomy is the removal of the fibroid only. And we also have hysterectomy, hysterectomy, which is the removal of the uterus. But no, by there are also less invasive procedures like the uterine artery embolization. You should see a doctor when you have heavy bleeding, pains, pelvic pains, inability to get pregnant, signs of anemia, which is redness and swelling. Endeavor to meet a medical personnel. Me, I love giving my personal experiences as a female to help relate from the real life aspect, but unfortunately I've never been through this, so that's why I really have nothing to say about this personally. But I'm very certain that from what I've said here, that it would likely help some of you from the few symptoms I've mentioned. If you've noticed any of the symptoms, noticed any of these things I've mentioned, at least you have an idea of what's going on. Well, not certainly, but at least you should know that you actually need to go see the medical personnel, so you know and be sure of what is actually going on with your body. Said, I'm sure you guys are now aware that fibroid isn't cancer, and you shouldn't ignore any of these things I've mentioned. So guys, if you enjoyed this video and you found this helpful, please kindly leave a comment, like and subscribe to my channel so you get to see my next video I'll be talking about. Thank you for watching. Get to see.